Hello, and welcome to this training video that will cover the Hoyer HPL500. Within this video, we will provide an introduction to a passive lift, criteria for its use, and the weight limitations. In addition, we will explain the features and proper placement of the full back sling, as well as a demonstration with step-by-step instructions on how to transfer a resident. The Hoyer HPL500 is a full-body lift designed for residents who are immobile. Residents can be transferred from bed to chair to bed, wheelchair to toilet, and/or floor to bed. The HPL500 cannot be used on residents weighing over 500 pounds. This section of the video will go over the following features. Hand control. The HPL500 is a powered lift. The hand control has two buttons for raising and lowering the lift. The base of the lift is opened and closed manually by foot. Push down on the pedals to open and close the base. If you have the electric leg opening option, your hand control will have two additional buttons for opening and closing the base. The hand control is magnetized for convenient placement on the lift. Battery charge. The battery is centrally mounted on the lift and is easily removed and replaced. To remove the battery, lift up the metal clip behind the battery. To replace the battery, align the battery against the mast and slide down while pushing forward, listening for an audible click to indicate the battery is in place. A charging station and two batteries are shipped with each lift. Batteries should be replaced once per day or after each shift, depending on usage. Emergency button. The big red button on the control panel is the emergency stop button. Its purpose is to stop electronic operation of the lift. Simply push the red button in to abort operation. To resume control, turn the red button in the direction of the arrows and it will pop back out. Emergency raising and lowering. Below the emergency stop are four buttons. The up and down buttons are redundant controls for raising and lowering the HPL500. The sideways arrows are redundant controls for opening and closing the base of the HPL500 if you have the electric leg version. The sideways arrows will not function if your HPL500 has a manually operated base. This system will work if the remote fails to operate properly, but the battery still has a charge. The red collar at the top of the actuator is used to provide additional safety if there is a battery failure. Turn the collar clockwise to slowly lower the resident down safely. Battery display. Located under the redundant controls is an LCD display. The battery status display indicates the amount of charge in the battery. In this state, the battery is full. When the indicator looks like this, it is recommended that the battery be charged. At this state, battery charging is required. The lift will provide an audible signal to indicate the battery requires charging. The empty battery symbol indicates the battery has no capacity and should be replaced immediately. Continued discharge to this level will cause permanent damage to the battery. Smart monitor display. To access the smart monitor information, momentarily push the up button on the hand control or on the control box. From top to bottom, the numbers displayed represent lift cycles, workload, overloads, and service indicator. See your manual for more details. Casters. The rear casters have locks that are engaged by using your foot to lock them. To disengage the locks, use your foot to push the casters up. These locks are only used in two situations: when parking the lift or when you are picking a resident up from the floor. Now let's take a look at the side of the lift that is used by our residents. 6-point cradle. The loop-styled cradle rotates 360 degrees, allowing you to pick up residents from almost any location. There are 6 attachment points for this sling. Normally, the front and back ones are used with most transfers. Scale option. The optional weigh scale uses a digital display and should be zeroed out before each lift. The steps for using the scale are as follows. Step 1. Attach the empty sling to the cradle. Step 2. Ensure the scale is hanging vertically and is free to pivot at both the top and bottom connection points. Ensure the scale is free and clear of any obstructions and press the 0 button to set the system to 0. Display will then read 0.0. Step 3. Press the kilogram/pound button to choose display modes. Step 4. Remove the sling or stretcher and position the resident. Reattach the sling to the cradle, ensuring the scale is hanging vertically and is free to pivot. Step 5. Carefully lift the patient, and when the motion has stabilized, press the Weigh button to display the weight data. Do not touch the patient or sling during this step. Note: auto power down is set for 60 seconds to conserve the battery. To wake the system, simply press the Weigh button again. Hoyer lifts are tested for safety in all transfers. This video will demonstrate how to remove and attach the full back sling. Sling sizes are color-coded. A brown trim is used for pediatrics. The red trim is used for small slings. Yellow is a medium sling. Green is large, and blue is extra large. The sling is marked with the size, laundering instructions, and an arrow. The arrow indicates the top of the sling, and the label goes on the outside, away from the resident's body. Purple tabs are aligned down the center of each sling for assistance in aligning the sling. Now let's go through the steps of transferring residents using the HPL500. Before taking the lift to the resident's room, you should always check 2 things. First, make sure the battery is charged, and secondly, ensure you have the correct sling size. The sling size can be found on the sling's tag and on the resident's care or service plan. A sling guide is located on each lift. In this video, we will demonstrate a bed-to-chair transfer using the full back sling, which cradles the head as the resident is being lifted. Caregivers will stand on each side of the bed and log roll the resident to one side. Fold the sling in half using the 2 purple tabs to indicate the center of the sling. The purple tab at the top should be placed at about the resident's shirt label and the other at the tailbone area. That helps to provide an accurate and centered fit of the sling. Begin tucking the top portion of the folded sling under the resident. Then, roll the resident to the opposite side and gently spread the sling out flat so that the resident is lying evenly on the sling. Next, we will place the leg portion of the sling under the resident. Begin by tucking the sling under the knee on both sides. Then, thread the right leg strap through the dignity strap on the left leg strap. Finally, cross the right leg strap with the left leg strap. This will increase both the resident's dignity and their safety. Now bring the lift over to the resident's bed. We want our resident to be the center of gravity, so you do not need to lock the wheels. Since we are taking our resident to a seated position, you may want to raise the head section of the bed. This will put your resident more at ease and decrease the amount of time they are being lifted. Using the hand control, lower the cradle at or just below the resident's shoulder. Begin by attaching the shoulder straps to the cradle and then attach the leg straps. If appropriate, inform the resident that they are about to be transferred. Using the hand control, push the up arrow button. Before beginning your transfer, make sure the resident has clearance under their buttocks and that their heels are not sliding across the bed. We want to make sure we are not creating any shearing or friction when we transfer the resident. Move the lift to your destination. Once the resident is at the chair, align them towards the back of the chair and begin lowering them while using the sling to guide them towards the rear of the chair. If we sit the resident too close to the front of the chair, then we will have to reposition them, which defeats the purpose of using a lift. When the resident is comfortably seated, lower the cradle to the resident's shoulders and begin removing the straps. Then take the lift away from the resident so that you can safely remove the sling out from under them. To remove the sling, begin with the legs and guide one strap out at a time. Then guide the sling out from behind the resident. When transferring a resident from a chair to the bed, you will lean the resident forward and slide the sling down the resident's back. Position yourself on one side of the resident's leg and slide the sling under their thigh. Repeat this process on the opposite side, and then thread the dignity strap through the leg portion of the sling. The resident is now ready to have the lift brought to them. Simply attach all 4 points of the sling just as we did before. This concludes the training on the Hoyer HPL500 patient lift. Thank you for watching, and if you need more information or further assistance, please call our 800 number or visit our website at www.journs.com.